If you're watching this after an abortion and you're feeling worried about bleeding, I want to start by reassuring you that this is something we see very commonly, and for most people, it's a normal part of the body healing. After an abortion, the uterus is contracting and returning to its usual state, and bleeding is part of that process. How much bleeding you have and how long it lasts can vary quite a lot from person to person, and that doesn't mean anything is wrong. After a medical abortion, bleeding is often heavier at first, sometimes heavier than a period with clots, and that usually happens over a few hours before gradually easing. It's also very normal for lighter bleeding or spotting to continue on and off for a couple of weeks. After a surgical abortion, bleeding is often lighter and tends to settle more quickly, sometimes within days. Some cramping is expected too, similar to period pains, and that's the uterus doing what it needs to do to heal. What we want you to feel clear about is the difference between what's expected and what might need checking. Bleeding that soaks through 2 or more maxi pads an hour for 2 hours in a row, very large clots continuing for several hours, feeling faint or dizzy, a fever, or a strong unpleasant smell are not things to ignore. Sudden heavy bleeding after things seem to be settling, or pain that doesn't improve with pain relief, should also be assessed. Most people recover without any complications, and their bleeding gradually settles over time. During this period, being gentle with yourself, resting, using pads, and giving your body time can really help. Please remember that you're not expected to just cope alone with worries about recovery. Feeling anxious or uncertain after an abortion is completely understandable, and support is part of care, not something you have to earn. If something doesn't feel right to you, it's okay to seek advice. You're not alone, and reassurance and help are always available when you need them.